Hello friends, welcome to RAGSMED. Today we are going to study about the first cranial nerve, that is the olfactory nerve. So first let's see this diagram. Here we can see that this is the external ears with the presence of hairs, and this is the nasal cavity. Here it is the presence of hard palate and soft palate with uvula, and here is the presence of teeth. So at the roof of the nasal cavity there is specialized olfactory neurons, this one. So here we can see this is the olfactory axons, and this in the center, this is the olfactory body, whereas below there is the presence of olfactory receptors with terminals. So these are the terminals. So this is called as bipolar neurons, and there is a lot of mucus layer here in the nasal cavity, and purpose of this mucus is important. It not only humidifies or warms the incoming air, but it also can trap the odor particles. When any kind of odor particle is sensed by the nose, it first moves through the external ears. Here it is external ears, then it is going to move to the nasal cavity, and the odor particle will start dissolving into the mucus layer. Why it is important? Because right above the mucus layer there is a presence of bipolar neuron having one dendrite and one axon extension. So these bipolar neurons are actually the olfactory nerves. Now the group of axons of olfactory neurons come to fuse together to form an olfactory nerve, which then passes through the cribriform plate. These are the cribriform plate of the ethmoid bone into the olfactory bulb. This blue color structure is the olfactory bulb, which lies just below the frontal lobe of the cerebral cortex. Now there are a lot of different types of cells, such as epithelial cells, which supports the olfactory neuron, and it also secretes mucus and also helps in the movement of air. And there are also a lot of different types of gland called as Bowman's gland in this area, that is also known as nasal gland, near the olfactory neurons, and they are important because they produce mucus. Now from this figure, let us see how these olfactory nerves are going through cerebral cortex. First let us see that there is the presence of mucus layer here, and these are the bipolar neurons, also called as olfactory neuron, which form nerve that move through the, these are the nerve, olfactory nerve, which move through the cribriform plate of ethmoid bone, as we have already discussed, and then they enter into the olfactory bulb. Now they will give off the axon terminals, and there is another type of cell in this area which gives off dendritic extensions. So this red color one are the dendritic extensions, which then interacts with these axon terminals, forming the glomerulus. And there is specialized structure in the area of olfactory bulb called as glomerulus. This one is the glomerulus, consisting of axon terminals as well as dendritic extensions of mitral cells. So this red color cell is the mitral cells. Now when different odor is sensed by the receptor of our nose, then the axon terminals will release excitatory neurotransmitter, which activates these mitral cells, and it will send the axon potential down their axon through fibers of axon, forming olfactory tract. Now there is another kind of cell which have extensions connecting these dendritic extensions and extensions connecting mitral cells. This one. And this cells is known as granule cells. When the axon potential moves upward, the granule cell are activated by these mitral cells, and granule cells will release certain chemicals on mitral cells such as GABA, also known as GABA aminobutyric acid, which inhibits neurotransmitters, that is, it will inhibit these mitral cells. And so that only most excitatory impulses coming from the olfactory neuron reach the cerebral cortex. Now, this olfactory tract, when it starts moving, it will branch into two different structures. First one is known as lateral olfactory striae, this one. And deep to the temporal bone lies a structure known as uncus, which supplies different structures such as piriform cortex of temporal bone, and then periamygdaloid structure, which form the primary olfactory cortex, and also entorhinal complex and hippocampal gyrus, which form the secondary olfactory cortex. And these are responsible for the olfactory sensations. Now another one is known as medial olfactory striae, which gives branch to subcollateral gyrus and also orbital frontal cortex. Now let's see the clinical anatomy of the first cranial nerve, that is olfactory nerve. First one is anosmia. Anosmia is the loss of olfactory fibers, that is inability to smell with aging due to nasal or paranasal infection, that is sinus, and also due to olfactory group meningiomas. Second one is allergic rhinitis, such as sneezing, nasal congestion, nasal itching is caused by allergens, which leads to temporal olfactory impairment. Third one is head injury. Olfactory bulbs may be torn away from olfactory nerves as they pass through fractured cribriform plate of ethmoid, leading to anosmia. Such a fracture may also cause CSF rhinorrhea, that is CSF leakage through the nose. Fourth one is uncinate fits, that is lesion of lateral olfactory area may cause temporal lobe epilepsy or uncinate fits. These fits are of imaginary disagreeable odors with involvement of tongue and lips. So here we finished about the first cranial nerve, that is the olfactory nerve. If you find this video helpful, then please like, share and subscribe, and stay tuned for more videos of neuroanatomy. Thank you.